Welcome to the Abuki Cabal Show.
What's going on, ladies and gentlemen? I want to thank everybody for sticking around, listening to my content, and for their interest in factual information concerning our current dilemma. That is the SARS-CoV-2 pandemic. Tonight we're going to talk about comorbidities, because everybody always likes to bring up comorbidities, and I just wanted to go into that a little bit to try to explain why you shouldn't allow comorbidities to give you a false sense of security. Comorbidities are basically other illnesses that are going on that could exacerbate your condition if you come into contact with COVID and become infected. So we'll read off the definition here. And comorbidity or comorbidities, plural, the simultaneous presence of two or more diseases or medical conditions in a patient. Age and comorbidity may be risk factors for poor outcome. A disease or medical condition that is simultaneously present with another or others in a patient or patients. Patients with cardiovascular or renal comorbidities, and renal means kidneys. So the reason why, a lot of people are saying that they don't want to get the vaccine is because they don't have any comorbidities. They don't have any issues that would cause them to have a poor outcome if they were infected with COVID. And basically, I just wanted to go into a couple of stories that basically nullify that argument. With the Delta variant, we're starting to see more younger people without comorbidities who have died in the second wave. Okay, data is showing. Okay, this came out of India. It says all India picture unclear as only 3 states are sharing comorbidity data of COVID-19 deceased. Doctors are calling upon states to reveal data on both comorbidities and the spread of the variants to gauge their impact on the COVID-19 deaths. Okay. Here we have, here in Arkansas, a UMS report warns about the severity of the COVID-19 surge, youth at risk, according to Rachel Sanchez Smith, who wrote that report. And it shows the data and the surges in patients who are not in the group of potential people who could be infected with COVID-19. They don't have the comorbidities. So there you have another story which references this data that shows that comorbidities are not a something that you should look upon as a level of protection. Here's another one, COVID-19. By the numbers, vaccinated continue to be protected. There's another question that always comes up, not a question or a statement that comes up that says that basically, even if I'm vaccinated, I'm not protected. Well, the data does not support your claims. The numbers of people who are actually coming in to the hospital who have been vaccinated are very low. Those are called breakthrough cases. And I'll show you a little data on that. And here is some of the data that's been shown in some of the other that's been referenced by other, media sources who are presenting this data so that you can take a look at it. And they're trying to put it in a visually friendly way by the states. So in the red, you see that it says the breakthrough cases are not driving the U.S. COVID-19 surge. The red is reported cases among not fully vaccinated people. So in Alaska, it's 96%? And the yellow is reported cases among fully vaccinated. So you see there, look at the yellow, look at the red, and you'll see that, the bulk of the cases. And that's that word doesn't even give it the thickness that it needs for you to kind of visualize. But if you take a look at this, you can freeze it, copy the page, whatever you want to do, screen grab it, screen capture, so that you can look at that data. But it's there. The majority of what we're seeing from state to state is red. Huge numbers of people who are coming in. 99% of the people who are I'll put the 99 to 90s. None of those 90s are actually low, except for one. The lowest of those is 94.1%. And that's in Arizona. Of the cases that are coming in are from people who refuse to be vaccinated. So when people say that, oh, you shouldn't, discriminate against us, those of us who refuse to get the vaccine and we don't believe in it. This is why people are angry, because, it was an issue when we were talking about healthcare, and health insurance and coverage and whatnot, about all of these people who didn't have insurance, who were gumming up the works, who are inside of the hospital system, and they're basically getting all of this care and they can't pay for it. Well, all these people right here, we've seen the statistics on most of the people who are coming in there who are not supporting, but who are among the numbers of people who are believing the misinformation about vaccines, the efficacy of the vaccines, are poor people who don't have insurance, people who are just reluctant to believe any of the sources. And I only use reputable sources. I don't use any of the data that comes from these sources that can't be validated. Testing that's not even peer-reviewed or respected because it hasn't gone through the normal process of validation of and reproduction of its results in a scientific method. Outside of the United States and these other countries, India and Egypt and some of these other places where these people are doing things and they just refuse to go through the process that is normal for you to be recognized by your peers worldwide. So, getting back to, the data and what it shows, you look at the reported cases among the fully vaccinated people are extremely low. So that should give some people some comfort in knowing that, these people are not the people who are going into the emergency room and who are having these ill effects from the COVID situation. So we're going to talk about some of the breakthrough data that they're talking about. In some cases, the breakthrough infections may lead to persistent symptoms, and this I'll probably reference this again in another video that I'm going to be doing on long haul COVID. It talks about long COVID is a poorly understood set of symptoms that can plague people for several months after the active infection has ended. While those symptoms eventually resolve in many patients, there is a subset of people who have long COVID, who just aren't able to recover at all, says Akiko Iwasaki, an immunologist at Yale University. Only a couple of small studies have investigated how common or severe long COVID may be after breakthrough infections. It is likely to be rare. Some experts say because breakthrough infections are uncommon to begin with and shorter in duration, in one study in Israel, about 7 of the 36 people in breakthrough infections had persistent symptoms for more than 6 weeks. And in a survey of COVID-19 survivors, 24 of the 44 with symptomatic breakthrough infections reported lingering problems. We really need a wider national or even international survey, Dr. Iwasaki said. So, people are also concerned about, the daily changes in data. And here we see a request by an immunologist for a study to be done so that we can get to the bottom of how large this phenomena is about the long COVID. Okay. So here's another, Dr. Angela Musin. I murdered that. You guys, bear with me. The biggest objection seems to be that the piece says breakthrough is uncommon and thus the risk of long COVID is reduced. How can we know if breakthrough infections are uncommon if the CDC isn't tracking the ones that don't result in the hospital? Okay. So this is another thing that I brought up in some of my other, my past videos where I talked about how we have huge numbers of people who are inundating the hospital system, but rarely do we talk about the people who just refuse to come to the hospital, who are sick out there, just out in their homes. They don't talk about the people that they end up going to the homes and they find them dead in their homes. Now, this may not be a large number of people, but it's enough. It's enough for it to be a problem, So that's another aspect of this that we're not talking about. So on the small end of this article, it says breakthrough infections are likely to be uncommon, but data is lacking. It's unclear exactly how common breakthrough infections are. Most estimates rely on figures predicting the Delta variant's rise in the United States. There's also too little testing in the country to get an accurate assessment. I think that if we started to test people just randomly on the street, we would find out a lot more people who test positive. We would find a lot more people who test positive, said Dr. Abar. Karen, okay, an infectious disease fellow at Stanford. Some experts believe breakthrough infections are likelier after exposure to the Delta variant than prior forms of the virus. Even when more recent data becomes available, however, it still is likely to show that a vast majority of hospitalizations and deaths from COVID-19 occur in unvaccinated people. Now, see, that was done prior to that data on the Vox article coming out. So they suspected before the data came in that was going to be the case, and the data after it came in supported what this doctor was talking about. So again, you see where you have a hypothesis, an idea, based on the data that you're getting, the raw data that you're getting. And then once the studies are done, the studies either support what you thought or they go in the other direction. So that's the way the process works. But unfortunately, a lot of the lay people out here, they get the information and they go, well, how can we trust you? Now the information is different 2 days later, you know? And see, that's where I think that the system has failed people, because we are in a fast reporting cycle world. And people who are in the field, scientists, medical personnel, we know that data comes in constantly, and you have to reassess your position, reassess your treatment, reassess what you're doing. But the common goal, the main goal, is to find a treatment that works so that people are able to weather the storm or the disease that you are trying to cure or to treat. So that's our task. You just have a small window into what we're trying to do. So to sit back and look at the process through a funnel and say, this doesn't work. I don't trust this. If you want to change the process, I suggest you become a scientist, become an immunologist, become a virologist, become a nurse, a doctor, whatever. Get inside of the process if you're so afraid of it, and change it from within. Because if you're not represented within the process, then you'll never trust it. It's bad now. You don't trust a lot of the people, Black people, other people of color who are in it, who would take issue with unethical practices taking place. So that's something that we all have to take ethics. We all have to do what is best, for our patients. And, that Hippocratic Oath says, that you are in this to heal people and to do no harm. That's important. Now, yeah, there could be some nefarious people in here, but you know what? They would have to be supported by a whole bunch of people, in order for something to happen like that. It would have to be a vast, conspiracy, and I don't know, that nobody, people talk too much. So, and I'm getting off into the weeds, but that's my spiel on the comorbidities. If you would like to look into the comorbidities a little bit more deeply, I suggest you just go ahead and Google it, and you can go to the Cleveland Clinic. You can go to Harvard Medicine, any of the websites, the CDC, medical libraries, and read the data for yourself. Read the data for yourself, make a decision based off of reputable sources and good data, not, how you feel, the stories that you get. My cousin overseas, testicles swole up and grew an eyeball and all of that kind of stuff, just these anecdotal stories, that basically induce fear into the population, and don't be driven by fear when you make a decision. Never make a decision based off of fear, or a lack of information because you didn't look for it. So I'm going to end there. I appreciate you guys hanging out. It has been great. I really appreciate you guys sticking out with me. Please like, share, and subscribe if you like what I'm doing. I will continue to look at the data that comes in on a daily basis, and I will collect it and I will get it out to you because I care about you guys. You make whatever decision that you see fit. But I have done my due diligence by trying to put this information out so that you can make that decision. Again, I appreciate you guys, and thanks for hanging out with me.
In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
I feel like a